Welcome back to Spotlight. I'm here with the Chief Environmental Health Officer, Mr. Cannell Smith, and Dr. Paula Chapman Hastings of the Health Services Authority. And we're going to talk about mosquitoes and the chikungunya virus. Welcome to Spotlight.
Thank you.
Thank you. It's a pleasure to be here.
Yes, it's good to have you both. I want to start with you, Dr. Chapman Hastings. You had special training with dealing with chikungunya?
I did. After we had our first confirmed suspected cases in Josephine Dyke earlier this year, I was given the opportunity to represent the British Virgin Islands in Guadeloupe at a conference that was sponsored by the Pan American Health Organization, the World Health Organization. And it was held in Guadeloupe because the French have had experience dealing with chikungunya in the Pacific Department on La Réunion. So they've done quite a bit of research because they had the money to fund it and they had the interest. And they were willing to share the information, not just with the BVI, but people throughout the Americas. So we had delegates from Barbados, Guyana, Suriname, Montserrat, Anguilla. So it's an opportunity for all of us to get together and share ideas, ask questions, exchange information, and maintain relationships for how to deal with the disease.
So what special things or what specific things that we needed to know about the virus that the research has shown and the people in Guadeloupe had found out and we need to know about?
Well, by the time we got to Guadeloupe, the Guadeloupe, Saint Martin, and Martinique had an extensive chikungunya infection. And one of the things that was important to recognize was that while it wasn't a disease that caused death in a large number of cases, a very small percentage of people would have died because of chikungunya. A significant percentage of people would go on to have persistence of pain over time. So we're talking about statistics of 80% of people who still have pain at 3 months, 57% of people at 15 months, 47% of people at 2 years who are still being impacted by this disease that they contracted from this mosquito.
So there's feeling pain in the joints, particularly like arthritic pain? I mean, what kind of pain?
I think we need to start at the beginning and talk about exactly what chikungunya is and how it presents before I tell you about the chronicity. Because there are different phases of chikungunya. There's an acute phase, there's a chronic phase. And if we start with the chronic phase, it's like taking a book and starting at the back and then trying to figure out how we got there.
Sure, I was gonna come back. I was on that line, but I was gonna come back. But okay, so then let's start off then with what is chikungunya?
Chikungunya is a mosquito-borne disease that has probably been around in Africa for hundreds of years, but only started to be recognized for what it was in the 1950s. By 1970, there were outbreaks, but they were relatively mild, and there wasn't a lot of research done. By 2006, when we started to have outbreaks of larger scales, more research got put into figuring out how the disease manifested. And luckily for us, the French put quite a bit of money behind it, and we have information. The disease is spread by mosquitoes. So a person who has chikungunya, in the first few days of becoming infected, is able to, if they're bitten by another mosquito, pass that virus into the mosquito itself. The mosquito then takes another 10 days to replicate the virus before it can pass it on to someone else, which is why vector control is so important. But the symptoms of chikungunya are what makes it such an interesting disease. Chikungunya gets its name because in one of the languages, the Makonde language, it means to be hunched over. And that's the typical posture of somebody who has debilitating pain. They're mostly having pain in the joints. They may have pain with swelling. They're unable to do the things of normal living that they are accustomed to doing. Normally, they would have had acute onset of fever prior to the joint pain or at the same time. Some people find it difficult to tell you which one really came first. They may have headache. Some people do have backache, muscle ache, but you have less muscle ache than you would see with dengue. It really is mostly focused on the joints. You can have gastrointestinal tract symptoms, nausea, vomiting, diarrhea, but those are less common. Some people do have skin rash, usually around day 5. It can be very itchy. And multiple joints are usually involved. It's usually symmetrical. And it's usually the joints of the hands, the fingers, the wrists, the elbows. Some people complain of the knees, the ankles. And what can happen is you have inflammation of the joints themselves and sometimes of the tendons. So I have seen patients who tell me, doc, I'm a chef and I can't hold a knife. I'm trying to pick up my cup and I can't get to hold it because the fingers just won't close the way that they know they're supposed to. So that's how a chikungunya would normally affect somebody initially.
How is it treated?
Unfortunately, the treatment for chikungunya is based on the symptoms and maintaining hydration. So if you're having severe pain, a doctor will normally recommend pain medication, maybe anti-inflammatory medication if we're sure it's not dengue, and then making sure that the patient drinks lots of fluids so they don't become dehydrated, and trying to avoid being bitten by more mosquitoes, not just because you're afraid of contracting another mosquito-borne illness, but because you don't want to pass it on to the others around you. Chikungunya does have a more chronic phase. So whereas in the acute phase, within the first 2 to 12 days of being bitten, the symptoms that I discussed before may arise. Some people do continue to have the joint pain for months and months, as I had alluded to before. And they have other symptoms as well. Some people go on to have depression. They just feel generally unwell. They don't understand why they're lethargic. They're unable to keep Some of them are unable to keep their jobs because they have so little energy and are unable to function.
Do you ever get rid of it? Does it ever leave the system? Can you say that at some point none of those symptoms, chronic symptoms or initial symptoms, will remain?
The hope is that everybody who would contract chikungunya would have a very mild, short course. That's not always going to be the case. The people who have the more severe reaction are the very young and the very old. There are actually some people who may go on to have complications of the nervous system, the kidneys, the liver, because they may have had a predisposing condition, another illness, diabetes, hypertension. The thought is that if you're in the very young age group, newborns, the very old age group with chronic illnesses, or you have previous joint pain, you're likely to have a rougher course of the illness than if you are 30 years old, say, healthy, playing sports every day. I mean, it could knock you down and make you feel really awful, but the expectation is that you will make a full recovery.
Early recognition and early treatment has any impact?
Early recognition and early treatment allows for us to confirm that it is chikungunya. And what we experienced in the Jocelyn Dyke scenario in December, January, February, when patients would ask, but doc, if the treatment is the same as dengue and the symptoms are similar to dengue, why are we testing? But when you get dengue, you feel better within a couple weeks, and you just worry that you don't contract dengue again because of the potential for a worse course the next time around. With chikungunya, you want to know because you want to be prepared psychologically, I think, for whether or not you may have aches and pains again in 2-3 months. What happens in some cases, isn't that not every patient will have pain today, tomorrow, 6 weeks later, every single day. Some people have told me that they thought they were feeling better. They went back out to work, they started, and then the pain came back, the swelling came back. And because though we've diagnosed it, we've confirmed that it is chikungunya, you just reassure and you treat, and the treatment can be a little more aggressive. You can use steroid instead of just the non-steroidal anti-inflammatory meds to deal with those joints, because you know that you're dealing with something that is now talking about chronic inflammation, and then you have the option of referring on to specialists who then deal with more persistent joint problems, and the people who are having depression can be seen by the psychiatrist as well for support help. We can involve the physiotherapist. So knowing what it is helps us to have a team approach to treatment.
So persons do need to go to the doctor as soon as they recognize some of these symptoms.
It is useful. We would really, really have benefited if people had come forward as soon as they thought they had it. One of the problems that we faced was that people are popping up 3-4 months later with a history of having had severe joint pains with high fever at Christmas, and or in April, and they are now complaining of pain and swelling. And based on the history they've given, you're thinking you might have had chikungunya then. This may be chikungunya. But it's harder to do the confirmatory test at that point than it would have been if they had come in right away. As far as treatment goes, we can be as aggressive as the pain requires from day one. But knowing what it is helps us to then make a plan, not just for the individual patient, but as a public health scenario. If we have a significant proportion of the population who's out sick because of a disease that affects them for potentially years, then we have potential for major loss economically. We have potential for people who lose their jobs just because the employers don't understand. And think that they are malingering. So it really would be useful if they would come early, because we are testing. The test that we do for chikungunya, Ministry of Health has been paying for it. We're not asking the patients to pay for it out of pocket, because as it stands right now, we want to know how many people in our population have been exposed to it, so that we can then formulate better plans for the future.
Okay. Let me bring the Chief Environmental Health Officer, Brother Colonel Smith, into the conversation. He's been waiting patiently. My brother, we grew up in Mosquitos, and we heard, as I mentioned earlier in the introduction, we heard about mosquitoes transmitting malaria in Africa, for example. And to us, to me personally, that was a faraway, distant place that had no significance to our lives. And you get a mosquito bite, you brush it off, the mosquito come buzzing around your ear, you brush it off. Mosquitoes wasn't really a big deal. I mean, I don't know. When I was growing up, it was a mosquito, was a mosquito. It didn't spread diseases that we knew of then. I mean, perhaps we have better recognition now, or better detection now. But as I said, when I was growing up, I don't remember anybody talking about mosquitoes spreading any disease. But here it is now. We have to look at mosquitoes from a different perspective, because of years gone by now, mosquitoes been spreading dengue fever, which is Dr. Hastings will explain, is a serious ailment, like a flu-like, with flu-like symptoms. And now here we have this debilitating virus, chikungunya, and God knows what else the mosquitoes gonna bring to the BVI that's gonna affect our, as Dr. Hastings said, our quality of life, our economy, our productivity, our whole social fabric. We need to start looking at mosquitoes from what perspective now, in your view?
Well, I think that what you have said earlier with respect to us having mosquitoes around from your time, my parents' time, it's quite true. We might have had dengue and never know that we had dengue, because the technology was never there for us to confirm that we would have had dengue. I think what is different today than in those times with respect to mosquitoes is that in those days we had our parents and our foreparents who used to take better care of the water that they have around their homes. we are now a multicultural society. So we have developed different cultures, and we, to put it quite clearly, that persons would have come to live among us with a different type of sanitary
Behavior.
mentality and behavior. Some better, some good, some not so good for us. Mosquito only breeds in, the dengue mosquito breeds in clean water, not really dirty water. If they breed in dirty water, it's a sign that they were desperate. They couldn't find the clean water to breathe in. So therefore, the breeding of the Aedes aegypti mosquito is mainly around the domestic premises, where people would be having the breeding utensils, water with utensils, utensils with water that would
Open standing water.
Yes.
Which is sometimes usually clean.
Yes, and you can,
When the rain falls outside, for example, and you have a container that's upright, and the rain falls in it, and you don't move
they
it.
breed in any container. It could be a wheelbarrow, it could be a cup, it could be a soda stopper, it could be anything that holds just enough water for them to lay their eggs. They would breed in that water. So what we need people to do is to make sure that they don't have utensils around that would hold standing water for mosquitoes to breathe. If they do that, then they can ensure that their premises will be free of mosquitoes. I know that many people complain about the ponds, but usually you wouldn't get the Aedes aegypti mosquito breeding in the pond.
And that's the one, and that's a mosquito, that's a species particularly that we have to pay attention to, the Aedes aegypti.
Yes, Aedes aegypti mosquito, because that's the mosquito that transmits dengue and chikungunya. So you need to make sure that you're not harboring the breeding of that mosquito in and around your premises, because if you continue to do that, and that is the problem that we have in the British Virgin Islands, based on our records, because we go around the territory day after day, week after week, month after month, and the amount of water holding containers is highly unsatisfactory. People are keeping too much old containers.
We are basically careless.
So that is something that needs to be taken care of, and I know that as soon as, like in this time, when we're having quite a lot of rain off and on, and then mosquitoes come out, people begin to get very, and now we have chikungunya, and we have a mixture of chikungunya and dengue, because we also have dengue going on right now. We had our highest incidence of dengue, I think it would have been in summer of 2013. And we have both chikungunya and dengue occurring simultaneously in the territory. I would say that the cases that started the outbreak of both chikungunya and dengue were imported cases. But that should not console us, that we need to rest on our laurels and don't do anything about mosquito breeding, because once you have someone who would travel to your territory experiencing having the virus and the mosquito bites them, then it will be transmitted to your population. And if somebody in your population was infected, and during the incubation phase of that disease, they are bitten by a mosquito and traveled elsewhere, then they would transmit that to that population. So it's something that we need to be able to address in terms of mosquito breeding in the territory.
Okay, we got to take a break for a word from our sponsors. But when we come back, we need to talk about, along with what we can do individually, as you mentioned, to depopulate mosquitoes in our immediate environment, which is, of course, not to have open standing water containers in our environment. What kind of measures we can take to protect ourselves once there are mosquitoes in the environment, and how to prevent the mosquitoes from feeding. So we're going to talk about those things as we come back from this break from this word from our sponsors. Keep it locked right at the Spotlight.
Spotlight is brought to you by the National Bank of the Virgin Islands and CCT Global Communications.
Welcome back to Spotlight. If you've just joined us, my guests are Dr. Paula Hastings from the Health Source Authority and Carnell Smith, Chief Environmental Health Officer. And we've been talking about Chikungunya virus and vector control about the mosquitoes. And if you missed any part of the program, of course, you can always go to jtvlive.net and it'll be there, and you'll be able to access that information. But it's some very important information. We need to know how to detect the symptoms early of chikungunya, and we also need to know how to stop the spread of chikungunya and other diseases, other mosquito-borne diseases, so that we need to know how to depopulate the mosquitoes in the territory. There are a lot of things that the environmental health is doing to depopulate the mosquito breeding. Brother Smith, talk to us about those things, and also, let us know what we can do as apart from keeping our environment mosquito breeding free. What we can do to assist you with the programs that you have initiated to control mosquito population.
Okay, first I'm going to speak to a very popular subject that the public likes to bring up when it comes to mosquito, which is fogging. Mm-hmm. And fogging just only provides a temporary solution to mosquitoes, because what it does, it only relieves you of it knocks down the flying adult population, and it can do that within a few days. But if the breeding containers are not taken care of, you would have a next adult population within another few days after we would have fogged. So fogging is not the solution to mosquito control. Mosquito must be controlled within the aquatic stages, which is the breeding stages in water. If standing water is not around, they have no place to breathe. So therefore, we need the number of containers down. Now, in environmental health, we know when our country is in jeopardy of having an outbreak. Reason being, we can look at the mosquito index based on our field study, and if our index is too high, of the Aedes aegypti mosquito is too high, we know that we have a problem if we should have any imported cases of dengue or chikungunya. So we do this by going around to the premises by premises on a daily, weekly to monthly basis, because we cover the entire territory of the British Virgin Islands on a daily basis, going from premises to premises, cataloging or counting breeding containers, which would be the wet, the dry, which may be potential containers and breeding containers. And based on our figures, then we would know where we are at in terms of our index or indices. And it's appalling at times to see and how many containers you have. And you can have a small geographic area which would represent a very low index. But if you have another small geographic area just within the same proximity of that area with a high container index, right? that could drive up the whole index for a given area. So it's everybody who needs to cut down on the number of containers they have breeding mosquitoes.
So some people will be doing a good job at removing the breeding containers, and right next door, the other person is not doing such a good job. That person started to almost affect the whole area, and what you're doing sometimes doesn't have the value that it could have.
Yes, it doesn't have that value because that individual, even if it is just one single drum or maybe 2 or 3 pails of water, may cause a problem in a very large geographic area. So that is why it's so critical.
Everybody to do their part.
Everybody to do their part. We are at the point where, so we go into the premises and we do all these checks. And if there are things that we can treat, we will treat. We are at the point now where things are so serious that we are going to have to take drastic measures in terms of persons who are harboring, breeding of mosquitoes and the containers that would breed mosquitoes on their premises.
You know, some sort of enforcement plan you're talking about?
Yes, of course.
So you're gonna start fining us if we meet containers on the premises?
Well, it might have to go to court because I can't give you a ticket. We don't have that type of legislation. But I can give you an order, a nuisance abatement notice.
Aside of a summons.
Yeah, and if you don't comply, my office can give you that notice. And if you don't comply, then you'll find yourself in court.
And the law stipulate any punishment or penalty if it reaches that stage?
Yes, if the penalty depending on if you don't abate the nuisance, you can be charged $250 a day for every day that you default.
Continue the situation.
Yeah, you can.
$250 a day.
Yeah.
That's even steeper than the waste management.
Okay, so we are hoping that we don't have to get to that level to get people to comply. You know, it's very simple. It's very simple. If persons who are in charge of a particular premises just take one day out of a week to walk around the premises to ensure that they are not breeding mosquitoes, it would mean so much for us. And if you have to store water, you can store water in a manner that it is not conducive for breeding mosquitoes.
Just keep it covered.
Keep it covered, but you have to remember that sometimes you cover a container, whether it's a bucket or a drum or a large tank. You might cover it, and the thing that you use to cover it might sag. And as the water fills up to the top or to the level, it reaches the sieve wire or maybe a piece of cloth.
Whatever the protection is.
Yes, and it comes a little bit over.
Its own container.
Right.
Yeah, a breeding catchment, so to speak.
And then that's all the mosquito needs, just to rest on the surface of that water and lay the eggs. And then you would have that container full of mosquitoes. Now, if that happens, a homeowner could take the initiative or the action to just pour a little bit of cooking oil on the surface of the water. And what that does is the mosquito breathes through its siphon tube. That it's protruded just a little bit to the surface so that it can get oxygen. And what happens when you put the oil? Some people, long ago we used to use kerosene oil. But you can now use manola, corn oil, or what have you. And cooking oil, and just put it over the surface.
Which is less dangerous.
Yes. And eventually over time the sun would break that down and evaporate it and what have you as well. What happens is when the mosquito come to breathe, it blocks the siphon tube and it strangles the mosquito. Now it strangles the larva.
Is right in this
that's the larva. But if the larva has moved on to the pupa stage, we must remember that the pupa stage is the quiescent stage of the mosquito. It doesn't feed. right? Now we can put other stuff in the water that if the mosquito feeds on the organic matter within the water, it causes the mosquitoes harm and they die, just like the oil on the surface. But if the quiescent stage of the mosquito, which is the pupa stage, it has gotten to that stage, it's there, it's not feeding, it's just hibernating and waiting to go into the adult stage. So you will have no effect on that stage at that time. So you want to make sure that you catch them in the first, second, or instar. First, second, or third instar of the pupa.
That's in the very beginning stages.
That at the very beginning stages.
Yeah, we can see we fall on the journey of the clock, but that water, now you're talking about these various treatments of water. Is that water we can still drink, or that's water we have to we only could use for bathing, or we only could use for animal? I mean, what happens to that water once we put oil in it, or once the mosquitoes contaminates it? Do we have to throw that water out, or how does that work?
Well, nowadays, the drums that you put around your house, you don't use that for drinking because we got cisterns. And there's a way to protect your cistern as well. You protect the inlet and you protect the overflow with the same sieve wire to make sure that
mosquitoes don't go in and lay in the cistern.
And lay in the cistern and make sure that your gutterings are well clean and don't have a lot of leaves and stuff in it that would cause trap the water and cause mosquito breed. But the water that you have out there might be just for gardening and doing certain little things around the house, not for really drinking.
Okay.
So,
so that's the water you're talking about.
Yes, but I would employ the public to discipline themselves to try and make sure that they reduce mosquito breeding around their premises, and that's the answer. And if they don't, then we're going to see more chikungunya and we're going to see more dengue. Their health is in their hands, and I know we often point our finger at the government, but you have a responsibility also for your own health, and you can't blame the government for every situation. You must take things in your hand. We give you information to act on. You act on the information, and if you act on the information that we have given you, then you're safe.
So we must begin to recognize the mosquito as a real public threat, and do whatever we can and use the methods that you've been giving us for many years now to depopulate.
Absolutely.
The mosquito.
Absolutely.
In the event, though, that you're not able to control what your next door neighbor does, we should take personal precautions. Screens at windows, nets over the bed when we're sleeping, the insect repellents off. Some people might be allergic, citronella. There are the things that you can use like vape mat that will cover the area inside a room. But we really, really need to protect ourselves. And the best way to deal with chikungunya is to prevent it rather than search for a cure when you're having pain months after.
And we need to stop the mosquitoes from biting us. We need to wear long sleeves, wear pants and shorts.
And
keep covered, and remember that the mosquito actually does tend to feed early in the morning or later in the evening when it's cooler. So if we are more aware of those things and we're more aware of our surroundings, then we can help environmental health help us.
And persons who are predisposed already to arthritis, if they get chikungunya, it's a lot worse.
It aggravates the situation.
It's a lot worse. So they must remember that if you are already predisposed, you already have some form of arthritis, you can only worsen your situation by contracting chikungunya.
Wow. Well, thanks. Listen, it's been a tremendous experience, a wealth of information that you both have brought to the public tonight. I really appreciate you taking the time. I know you're busy. I know it's not easy to take the time out to come on television, but we appreciate the information, and I'm hoping that we are taking this thing really seriously, and we take the personal responsibility to make sure that we not only prevent mosquitoes from breeding, but we also take precaution to prevent the spread of these viruses that really, really can cause serious challenges, health challenges, social challenges and economic challenges. I think we need to realize that. Thanks for coming to Spotlight.
Thank you.
Thank you.
Yes, indeed. We're falling at 8 o'clock. And of course, I want to thank my guest, Ayana Hull, for coming by with to talk about her book, The Pentateuch. The Pentateuch, I think, is an important book, and we need to get our children into reading it so that they can get a sense of some of the values that and the morals that our parents brought us up on. Also, of course, I want to thank our Chief Environmental Health Officer, Mr. Kenneth Smith, as well as Dr. Paula Trotman Hastings from the Head Sources Authority for coming by and talking to us about chikungunya and vector control, mosquito breeding control. Don't be a mosquito breeder, clean up your environment. Next week, the spotlight will shine on our former BBI, Shari Castro. She has a new program, Literacy for Children and Adults, and we need to, of course, continue to learn to read. Reading is really important for our growth and development for children and adults. So be here, don't miss Shari Castro and her new program. Spotlight is seen every Tuesday at 8 p.m. here on JTV Channel 55 and rebroadcast on Sunday afternoons at 2:30. You can see all the spotlights at jtvlive.net. Continue to email me at jtvspotlight@yahoo.com. Send your words of encouragement, your criticisms, your suggestions. I'm always happy to receive them. Thanks again for watching. Remember, when the spotlight is on, you see the facts. I'm Ed Urenco.
Spotlight is brought to you by the National Bank of the Virgin Islands and CCT Global Communications.